Hello everyone, my name is Dr. Akshay and today we are studying the pain, pathophysiology and its management, the first page of the symptomatology. Now, pain is the most common symptom of any disease. Like the quality, time course and location of the pain is important in the diagnosis for any disease condition. By the definition, it is an unpleasant sensation localized to a part of the body. Now the pain can be of many types. It can be a stabbing, burning, twisting, tearing, squeezing, terrifying, nauseating and sickening. Now from this we can say that the pain is both a sensation and an emotion. Now the pain is associated with the increase in the blood pressure, heart rate, pupil diameter, increase in plasma cortisol level and the muscle contraction. Now there are two types of mechanism, peripheral and central. Peripheral mechanism. So it is mediated by the primary efferent nociceptors. The peripheral now consists of three different types of neuron. First, primary sensory efferent, motor neurons and sympathetic postganglionic neurons. The cell bodies of the primary sensory efferent are located in the dorsal root ganglia. Now this is the axons. The primary sensory efferents can be divided into many types. Dependent on their diameter, conduction velocity. So the largest diameter is the A beta and it has the fastest conduction velocity. It is mainly responded to the light, touch and or moving stimuli. The smallest diameters are of the A delta and C fibers. It mainly responds to the pain and it is located in the skin, deep somatic visceral structures and the cornea. A delta and C fibers are the primary efferent nociceptors. Now the most nociceptors respond to the heat, cold, mechanical distortion, change in pH and the chemicals. And there are some nociceptors which responds to a particular stimuli like the vanilloid receptors which responds to heat, acidic pH, endogenous mediators and the capsaicin. Now the sensitization. When the intense, repeated or prolonged stimuli are applied to the damaged or inflamed tissues, the threshold for the activating the primary nociceptors are lowered. Means अगर हम कोई भी स्टिमुलस अगर बार बार देंगे किसी इन्फ्लेम्ड और डैमेज टिश्यू को, तो जो नेक्स्ट रिस्पॉन्स होगा पेन प्रोड्यूस करनी है वो उसको कम थ्रेशोल्ड पे पेन फील होगा, which can be mediated by the bradykinin, nerve growth factor, prostaglandins and leukotrienes. And now the sensitization can be of two types, peripheral sensitization and the central sensitization. Now the peripheral sensitization occurs at the peripheral nerve terminal, occurs in the damaged or inflamed tissue, starts when the mediators activate the intracellular transduction in the nociceptors, which causes increase in the production, transport and the membrane insertion of chemically gated and voltage gated ion channels, which increases the excitability of the nerve terminal and which produces the pain. Now the central sensitization at the dorsal horn of the spinal cord occurs when there is a increased generativity of the nociceptors during the inflammation. Now this sensitization is responsible for the tenderness, soreness and hyperalgesia. Generally the viscera are non-responsive to the noxious stimuli, but like in diseased process or inflamed tissues, this viscera or hollow viscous becomes characteristically activated to a distension or becomes sensitive to the mechanical stimulation. The A delta and C types of fibers are mainly located in this hollow viscous, and at these places these are called the silent nociceptors. Now the nociceptors does not only produce the pain but it also causes the vasodilation, mast cell degranulation, act as a chemoattractant for the leukocyte and increase in the production and release of the inflammatory mediators. These processes are caused by the certain substances which like substance P, CGRP and the cholesterol.